Good day, everyone. My name is Azeezat Fajembola, and I am a health advocate. As you know, we are in the month of October, and this month is for breast cancer awareness. Do you know that in 2020, the World Health Organization discovered, after analyzing the data they collected, that 2.3 women were diagnosed with cancer? 2.3 women in the globe diagnosed with cancer. That's about 12% of the world population of women. Now, that's huge. And of course, this contributed to the morbidity and mortality rates in women during the pandemic in 2020. Now, let's look at it this way. While the rest of the world were facing the pandemic, 2.3 women, and I'm sure it's even more than that, 2.3, at least 2.3 women with breast cancer, aside the population of men with breast cancer, were battling between the devil and the blue sea. They had the pandemic on one side and breast cancer on the other. Yes, I mentioned men earlier. Yes, men do have breast cancer, but to a lesser percentage. Many organizations have been advocating for self-breast examination, and I hope you as a listener know how to examine your breast properly. If you don't, please ask your doctor to teach you on your next hospital visit, or just search for it on the internet and practice till you are good at it. So there's a lot of talk about breast cancer. What will alarm you that you have breast cancer or someone around you has breast cancer? So some symptoms are changes in nipple, pitting of the skin around the breast, known as peel the orange. Then, of course, because it looks like the orange, then breast or nipple pain above normal, change in color of the skin of the breast. If you see abnormal, you are not bleaching. If you see abnormal, change in the coloration of the skin around your breast. Then abnormal nipple discharge, which might include blood. Then lastly, lump in the breast. These are the major signs of breast cancer. So what are some of the risk factors of breast cancer? Increased age, especially in postmenopausal women. Then genetics. We know that if your mother or your aunt had breast cancer, you have an increased risk likelihood of developing breast cancer. We know the story of Angelina Jolie. Then obviously a risk factor is gender, the special beings. Yeah, being a female increases your likelihood of having breast cancer. That is why you need to do regular breast examination. Please give me the permission to sound vulgar, but sucking of the breast and massaging of the breast is not breast examination. So ladies and gentlemen, how do we prevent breast cancer? No alcohol intake, regular exercises, no smoking, non-exposure to ultraviolet radiation, having good diet, weight control, regular examination, which includes mammography, and early diagnosis. Early diagnosis is an important prognostic factor. For good prognosis of any disease, especially in cancer, early diagnosis is very, very important. I don't want to bore you with medical terminologies, but you should know that breast cancer can develop from any part of the breast, including the nipple. So this is the reason why you should check all parts very well during breast examination. So who are those that are encouraged to do the mammogram? Women above 40 years. What does mammogram do? It checks the breast tissue intensively and diagnoses breast cancer in its early stage. You can see a green arrow pointing to the lump. And for reference purpose, this is not a painful procedure. So there is no need to be scared. There is no need to delay it. As I said earlier, this is the month for breast cancer awareness. So many local and international organizations are subsidizing the fees for mammogram, doing free breast cancer examination, and doing more advocacy. Such an organization is the MCF, which was founded by Dr. Zainab Shinkafi Bagudu, the First Lady of Bauchi State, a consultant pediatrician, if I'm right. So if you want to join them or be a vendor at the event, contact them. So, ladies and gentlemen, that's just the basics I want you to know about breast cancer. I advocated a few years ago when I was still an undergraduate student on breast cancer awareness. And I want you to know that whatever level you are, you can advocate. Whether you are not a medic, you can advocate. A student, you can advocate. A comedian, you can advocate. Anyone can advocate. Because this is what affects every one of us, directly or indirectly. So thank you for listening. The fight is against cancer. Stay blessed and stay safe.